Hello, everyone. Welcome to my show. Autumn is here. I'm Francine, your host. Today, we're here with Shanna Ford, who has an independent healthcare agency which focuses on affordable healthcare. We want to welcome her to our show. Welcome, Shanna. How are you today?
Good. How are you, Francine?
Good. Thank you so much for taking the time to give us some information today. We really appreciate that. We want to go right into it, but we want to tell me a little bit about yourself and your business.
Okay, so yeah, my business, we're an independent agency. It stemmed from doing some community outreach, and it actually stemmed from my real estate business, honestly. I am a real estate broker here in Tampa, Florida. I do sit on a couple boards, one of those boards being the Government Affairs Committee. And at one point in time, we were talking a lot about just like affordable housing and things. And I was always from the frame of mind that, you really can't make housing affordable long term, and that people just need to learn how to make more money, save more money, conserve their health, be able to, do more for their families. So I started looking into different businesses and things. Health insurance was one that really stood out because I was able to actually hire individuals and start to do community outreach, and hire, help people get licensing, help them go out and do community outreach. But it quickly became a passion project for me. And I think you and I were talking about it. It got to a point where I was spending more time trying to help people, locate mental health facilities or locate rehab facilities. I was spending a lot more time on those things than I was in my real estate business. And so finally, my husband sat down and said, we need to just go full throttle with this. This seems like where your heart is. And we did that about 2 years ago, and we're in it. We're in it. So.
Okay. Okay. What are the things if you found out, like, as far as the statistics, it's like 26 million people are still not covered and don't have medical insurance. So how does your agency work with that? How do you help with that?
Yeah, so what I've found is a lot of it is just lack of awareness, lack of knowledge. A lot of people don't know. Most places that I'm going into our local businesses for community outreach, your local barbershop or your local self-employed individual, there's not really going to be an avenue where they're just going to get the information. And then there's so many misleading ads and things like that across social media that I think a lot of people are scared too, because right, when you're dealing with health insurance and you're dealing with personal identifiable information called PII in the healthcare information industry, but you're dealing with people's socials and their dates of births and their names and stuff, and people aren't usually so willing to give that up unless it's people that they trust and they know that have their best interests at mind. So it's really out of the way for the average person who's working and trying to hold down a household to go on a journey to try to find someone they trust, someone that's gonna give them the best options for them and their family when it comes to affordable health care. And then giving up that information that they need to be able to pursue that is it's not a priority for a lot of people.
Okay, so what would you say to people to kind of encourage them to do that? Like the things I'm sure you've seen different circumstances and situations come up where people needed your help. Maybe they didn't have insurance. What would you say to encourage people to do that?
Well, the first step is just finding someone that you trust. Usually there's community outreach centers in a lot of different neighborhoods. You can always actually go directly to the marketplace. So cms.gov is the federal marketplace where individuals go. And CMS stands for Centers for Medicare and Medicaid. So that's initially all that site governed. In 2010, when Obama came in and he actually put the Affordable Care Act into play, they decided that this was going to be the federal exchange where they would actually facilitate the enrollment of those policies, things of that sort. So you can go directly to cms.gov to see about applying. You can also call. Typically, they're going to have navigators. You're always welcome to reach out to myself. My website's, here listed at the top of the screen if you just have questions. But one amazing thing too about the federally facilitated marketplace is that you cannot discriminate, right? So when it comes to a trust factor, I don't need to know all of someone's medical information to be able to quote them and be accurate, because these plans cannot discriminate against pre-existing conditions. They can't discriminate against certain things that your regular health plans back in the day could say, oh man, this person's already sick, we're going to charge them an arm and a leg for insurance. They don't do that. It's based off of your income. It's based off of where you live and what plans are available in those areas. And you can literally give those 3 pieces of information and get an accurate quote on what it'll be without even giving name or information like that. So that's a good thing. You can get an accurate quote without having to, disclose all of your personal information or things that are, concerning you. Now, your health insurance professional can assist you better if you do want to say, hey, I'm, diabetic, I know I'm going to need a lot of prescriptions over the years or whatever, then we know, okay, even if the lowest price plan is available, there may be a plan that you can pay $30 or $40 a month for that's going to be better for you because you're going to need so many prescriptions or, because of services that you may need due to your own circumstances.
So if you're going through CMS, is there limited services? Is it something where it's kind of like discounted and limited services?
No, not necessarily. There's navigators. You're gonna have access to the same plans going on cms.gov that someone's gonna give you. That's a healthcare provider, and then that's a health insurance agency. And then us as an agency, there's no charge to you. So if you, for instance, were to call me and say, hey, this is the county I live in, this is what I think I'm gonna earn this year. Do I qualify, for insurance? What types of plans do I qualify for? That costs you nothing. You're going to get the same price whether you do that yourself or whether you have a licensed professional assist you with that.
So how would you be able to help someone if they were interested in getting health coverage? Like, would it be a cost if they called you? What happens then?
No, so I'm always here to help. This is always something that's complimentary. There's never a cost for speaking to me, asking questions. If I don't have the answer, I'm definitely here to point someone in the right direction with whatever I can help with. But a lot of times I may be able to guide them into a plan that's right for them. And if not, that's okay. I'll get them to the right resources to do that, but they never have to worry about coming out of pocket or anything like that to be able to, just speak with me and see what their options may be.
So you said you were in Tampa. So does this cover all the states, or is this specifically to certain states?
No, so the Affordable Care Act covers every state. It's a federal act. However, all states do not participate in the federal exchange. For instance, I believe Texas is getting ready to move to their own exchange. There are certain states where you just want to make sure you have a health insurance agent that understands how to operate within that exchange. So there's a handful of states that actually have their own exchange, but for the most part, a lot of states do operate under one exchange.
Okay, so if you were a caregiver of your parent, and you realized that their insurance didn't have everything that they needed, could you call and find out this information and try to get them a better insurance?
Yeah, so there's typically going to be professionals that can assist you if you call in to cms.gov. Now, depending on the age of your parents, I personally do not specialize in Medicare, right? So if they're 65 or over, that's going to be someone that specializes in Medicare and that can assist them with their specific needs, because Medicare is something completely different. Now, the marketplace plans for those under 65, yeah, those are going to cover what they cover, and that's something I could assist someone with if their parent was under the age of 65 and needed assistance.
Okay, so say if you were an entrepreneur and you're not 65, but you're an entrepreneur and you needed certain health coverage. Um, would you be able to call an agency like yours and get health coverage for yourself and also for employees?
Yeah, so they do have shop plans, which are for businesses to be able to cover employees as well. And there are people who specialize in writing shop plans. So yes, that is something available, and you can get plans through the marketplace. One thing to keep in mind too, marketplace, every plan has certain essential health benefits that they have to cover, right? So where some of your more privatized plans can say, okay, we only cover this, but we're not going to cover pregnancy. or we're not going to cover emergency room visits or whatever. There's essential things that have to be covered in marketplace plans. So that's one is ambulatory services, right? Emergency services, mental health. That's a big one because a lot of private plans don't necessarily want to cover therapy or if someone's needing to check themselves into a rehab facility. All marketplace plans have to cover mental health, laboratory services, hospital services, pregnancy, maternity, breastfeeding, pediatric, and then preventative care is something that's covered without it actually, you typically are not going to have a copay for preventative care. Those are typically things that you can get done with no money out of pocket, regardless of what plan that you're on. So it strongly encourages women to get their mammograms, their pap smears, men to go get their physicals, their annual exams, their blood work without having to come out of pocket for those things.
Okay. And is this something that you have to re-up every year? You have to look at it every year and re-up?
Yep. Yep. So typically, open enrollment is going to fall between November 1st and January 15th of the following year. So for example, for 2024, enrollment started November 1st of 2023. It ended January 15th for open enrollment. And so what that meant is anybody from any income could check, see if they qualify, select a plan. Now that January 15th has passed, we are in what's called a special enrollment period. So there are individuals that can still go onto the marketplace or reach out to a health insurance professional to see about obtaining a plan if they meet certain criteria. Like, one being they've actually lost access to healthcare within, a certain amount of time in the last 60 days. If they are lower earners and they earn under a certain amount, but they earn too much to qualify for Medicaid, then they can enroll all year round. So there are certain things that could, qualify someone for special enrollment period.
Okay. And when you go to the outreach center, when you outreach, what is it that you actually do?
So typically we're seeing if anyone is struggling with things that they have not been able to find care for. If anyone has applied for Medicaid and been denied for whatever reason, and now they just need assistance, being able to understand the different plans that are being offered. A lot of times, there's families with kids, there's lower earning, what they call in the industry gig workers. So that's like your Uber drivers and your DoorDash drivers. And individuals like that, it's maybe a job where it requires a much higher time trade to be a high earner. And the time most people have in the day isn't enough that's going to allot them to, earn six figures doing that. So individuals like that still need access to health insurance, even though they're kind of self-employed and they're doing their own thing. So yeah, it's when we're outreaching, we're just reaching out to anyone like that. What we found was like a lot of certain franchises, and I don't want to get in trouble with anyone, but like Subway, a lot of Subway employees do not have insurance. So that was one of our like main objectives when we started going out into the community, was like Subways, barbershops, hair salons, places where 9 times out of 10, the individuals working in there or running those establishments probably hadn't looked into, not most of the time they had not looked into health insurance options for themselves or their employees, or realize and understand how accessible it is. It feels like this big complicated thing, but when you have someone there that's obsessed over this problem, right, and understands how to help individuals solve it, then it becomes a much more digestible task to take on, and it's not very time consuming at all.
Have you ever seen any risk or anything that where people did not have insurance and what what happened to them or their situation?
Yeah, so even just coming from the real estate background, there was a ton of times where there's like so much medical bills, right? Coming up when people are applying for things. And I believe they've actually taken measures to make it where that's not hindering individuals so much when it comes to purchase homes and things. But a lot of times those emergency room visits are really expensive. A lot of times people aren't going to go get checked until it's time to go to the emergency room. And now you're going to get this massive bill. God forbid it's something that requires like a procedure or surgery or something like that. One bad health event can bankrupt a person, right?
Mhm.
One car accident where you don't have the insurance to get things that you need and now you can't get back to work or get back to a state of health where you can take care of your family. Those things can be very, very detrimental. Me and my husband were just talking about the movie John Q the other day, right? Like he didn't have the insurance in place to get what needed to be done.
Mm-hmm.
So yeah, health can, and I can tell you personally, I had a family member have a heart attack and us having to go into the emergency room. And once they seen that insurance card, it was, 45 minutes from arrival to the time that they had the stent put in. But I can't even imagine how that scenario would have gone had I walked in there saying I don't have coverage, right? This person I love and care about is having this major thing that probably costs a ton, and I don't even have insurance. I don't know how that would have turned out. So it's I personally feel like it's better to know you have it, and to understand what it covers, and also to understand like your maximum out of pocket. That's a term a lot of people don't fully understand when they see that on policy documents or things of that sort. But for example, let's say you have an insurance plan, and it's like every time you get a generic prescription, you only have a $30 copay, right? And every time you go to the doctor, you have a $30 copay. And you have this max out of pocket that might say is $2,000, $2,500. What that means is when you've paid $2,500 cumulatively between your copays or whatever it is, or if you got billed a portion of an emergency room visit, right? A lot of these plans will cover 75% of emergency room visits, but you're going to be billed for 25%. But once all that together hits that $2,500 mark, your maximum out of pocket, now for the rest of the year, everything that's covered under that plan is covered and you're not coming out of your pocket anymore.
Okay. Okay.
Right?
Yeah.
So, even things like that can be that's the difference between knowing the most I can be billed is 2,500 out of pocket versus leaving the emergency room with a 30,000, $20,000 bill you now have to figure out how to take care of.
Right, right. Medical costs has gone up so high, so high. You know, what I found that sometimes people are taking care of their parents and the caregivers do not have health insurance or they don't have adequate insurance and they don't go to the doctor, they don't take care of themselves. So this is good information for them, for the caregivers, to start thinking about making sure that they're covered. Because if you're not well, you can't take care of someone else. So, but a lot of times they neglect themselves because they're so involved with taking care of their parents, their grandparents, or whomever that's ill, that they miss doing their tests, doing things that'll keep them healthy, and being proactive about making sure that their medical insurance is viable and still in effect, and they have all the things that they need. So this is great information. So thank you. I appreciate that. Is there anything else that you would like to tell the audience that they
Yes,
need to know?
yes, yes, yes. Preventative care will save you not only so much mental stress and strain, right, of not knowing if you're healthy or if you have things going on. It's going to save you money. It's going to save you resources. And I think that was one of the big things when they actually put the Affordable Care Act, on the table, was that we're spending so much when people are having to come into the emergency room and they have to be treated and they're already so far gone and they've got these major things going on. Like it costs less to just go get your checkup. Just go get your checkup every month or every year or every 3 years for women. And again, not to keep bringing it back personally, but we all have personal situations that have hit us. But I mean, I lost an auntie to ovarian cancer that by the time it started bothering her, she was so far into it that there was pretty much nothing that could be done. And that's something nowadays that they can detect fairly early if you're getting your women's exams, like you need to. If you're getting those mammograms like you need to, you're not waiting to your stage 3 or stage 4, and now you're feeling bad, and now you're going in and finding these things out. So a lot of times, cancers, illnesses, things like that are caught early on have a much higher percentage of being able to cure them or fix those problems, rectify it, and for the person to go on and live a long and healthy life, versus waiting till you're actually feeling the symptoms. Typically, when you're feeling the symptoms of something that's going wrong in your body, you're pretty far gone. And when you're going in for those annual exams and those preventative checkups, they're drawing your blood, they're checking your levels, they're, making sure you're not pre-diabetic or on the borderline of something that could really be detrimental for you and your family. So I would say that's probably one of the biggest things I would say, like,
Mhm.
at least go get the checkups. Like, I know you may not like the doctor. Health insurance is not a fun topic. Just go get those checkups, know where you stand, no surprises. You'll be better for it to take care of your parents, loved ones, yourself, whoever else needs you.
Absolutely, absolutely. Well, thank you so much, Shanna. I appreciate you coming on and giving us this information. And again, she has her healthcareadvocacy.com. So please go on that if you have any questions. And if you wanted to just ask questions or to get some health coverage. So thank you so much. There's so many people that are not covered, and it once they start thinking about it, they get intimidated.
Mhm.
So this is good that you have this and you're giving this information. So I appreciate you so much for coming on. Autumn is here. Thank you.
Thank you for having me. I appreciate you helping us get the message out, because it's one that affects everyone, but definitely as minorities. So you got to get on top of it.
Absolutely, absolutely. Okay, thank you so much.
Thank you. Have a nice night.
You too.